we have for so long tried to protect the pregnant person by putting them in bubble wrap. Okay, we have people get recommendations to not lift more than 20 pounds, that they shouldn't be lifting their other kiddos when they're pregnant because of stress and strain on the body. With the idea being that your body is already under so much strain, we don't want to add to it. I honestly think that is the most BS theoretical framework I've ever heard.
Hi, Christina. I'm so excited to have you again on the Evidence Strong show. If you could briefly introduce yourself.
Yeah. So hi, everyone. My name is Dr. Christina Prevett. I'm a pelvic floor physical therapist and PhD who is currently a postdoctoral research fellow at the University of Alberta. That's a lot of words to say that I try and help people with pelvic floor injuries, and then I try and research how to make my rehab better. So my research is focused on heavy resistance training and some of the methods that we use for heavy resistance training, specifically on the pelvic floor. And then I've niched a little bit into heavy lifting during pregnancy and what that looks like. So a lot of my interests are in the role of heavy lifting in the pelvic floor and what that does when we're in different stages of the female life cycle. So pregnancy when estrogen is really high, menopause when estrogen is really low, and kind of all the nuance in between.
Awesome. Great work. Congratulations on your PhD, because when we were talking last time, we were not defending yet. So
yeah,
congratulations.
But I got those DR dots in front of my name now, so I can say that I did it.
Awesome. Okay, so we're talking about your recent paper titled Nuances of the Valsalva Maneuver and Bracing with regard to resistance training performance and its effects on pelvic floor. So with that in mind, let's start with what Valsalva Maneuver is.
Yeah, so when we are using the term Valsalva, it's kind of been really confused. It's been confusing in the research. For us as weightlifters, like strength and conditioning coaches and athletes, when we use the term Valsalva, we are talking about bracing and holding our breath to lift heavy weight as we can. And so that is kind of the term Valsalva.
Awesome. Easy enough. Do we want to go into what it does to the body when we hold breath during lifting?
Yeah. So when we are trying to lift really heavy weight, as the weight gets heavier on the bar, whether that's clean and jerk, squat, whatever it may be, a couple of things our body will naturally start to do. So the first thing is that as the weight gets heavier, we're going to gradually take in more breath. And the reason why we do that is to take up space, right? We want to take up space in our trunk so that our spine is protected. So we were going to inhale really big, and then we end up, at least for a little bit, closing our throat off so that we're not inhaling or exhaling. We're not breathing. We're holding our breath. So we take a big inhale, we close our throat off so that we're not inhaling or exhaling. And what that does is it increases pressure in our belly. This is a good thing. It helps us to lift more weight. It helps us move more weight. And then it also helps to increase the muscle firing of all those muscles around our spine. So what we see is that our erector muscles and all of our tiny like multifidi muscles, they boost when we hold our breath and take up space, which helps us lift more weight, right? So the more stiffness we can have in our middle, the more likely we can push weight up against the bar, whether we're coming off the floor or trying to squat, and it makes us stronger. If you've ever done really heavy weights, all of our weightlifters will say, hey, lifting weights is cardio. And it's because as we're doing the Valsalva maneuver, we also have our heart jacks up, right? Our heart rate jacks up, our blood pressure will jack up. And that, again, is another mechanism that we use to try and we're putting a lot of exertion into lifting as heavy as we can. So not only are we seeing an increase in pressure in our belly, we're seeing that stiffness in our spine, and we're seeing our blood pressure will go up and our heart rate will go up in response to the amount of effort. So as we get closer to our 1 rep max, that response is going to get bigger and bigger and bigger. That is not bad. It is our body's natural protective mechanism when effort is exerted on our body. So it is not a bad thing. It is actually a really good thing, and you will hold your breath without meaning to, at least for a little bit, as soon as we get up above 80% of our 1 rep max, because we are trying to make our spine as strong as we can to move as much weight as possible.
Awesome. How about pelvic floor?
Yeah. So here's where it gets a little bit finicky because when we do the Valsalva maneuver, we should be, if we think about our trunk muscles, we oftentimes talk about our core, and we talk about our core, but we don't really talk about what it is. And really it's this box in the middle of our bellies that helps us to lift weight or helps us to move in different directions. And so we have our core muscle, or our core muscles, which a lot of people think of as their abs, in the front of their belly. We have all of our obliques. We have our chest wall at the top of this box. box, we have our pelvic floor on the bottom of this box, and then we have all of our spine muscles in the back. We know that about 50% of female strength training athletes, whether they've had babies or not, can leak with heavy lift. Now, that is a massive number. And as a physical therapist, absolutely, this is a rehab thing. Like, we can help with people who are peeing when they don't want to be peeing, but it's also kind of a coaching thing. So obviously something is going wrong when we are thinking about lifting heavy weights. If the pelvic floor, which is part of this core group, is showing signs of dysfunction, which is we're peeing when we don't want to be peeing. And so what is happening when we're thinking about the Valsalva maneuver? Ideally, all of the sides of that box are contracting the same amount, and we are filling up that space, and all of that pressure is going in all the different directions of the box, right? And it creates stiffness and allows us to move more weight. But we are often taught, when we are taught how to brace, we are told, inhale nice and big, and then bear down into your belt or bear down into your belly. What that does, instead of distributing all of the pressure around the box, it puts that pressure down, which means the pelvic floor has a lot of pressure that it has to withstand in order to keep our urethra closed, to keep our holes closed so that we don't pee. So instead of distributing that force all around, what happens is when we bear down, it creates all this downward pressure. And when the pressure coming down is more than what our pelvic floor can close against, it means that we can pee on the platform, right? And we see it a lot in powerlifting, and we see it a lot in weightlifting. And that can be just a sign of your pelvic floor being your weakest side of your core canister. I see a lot of weightlifters that also have hip or low back pain that they're working with. That's another kind of sign of some weakness across that core canister, relative weakness. I'm not saying you're weak, I promise. But what we see is that there's a bracing sequence issue that happens that can predispose specifically female athletes to pelvic floor dysfunction. And so what my research and where my area of practice has been starting to focus on is how can we teach, I'm not even going to just put this into female athletes, how can we teach strength training athletes to brace better to make them not only stronger, but less likely to have pelvic floor issues? Because for women with a Valsalva that's more of a bear down versus a distribution of pressure, they may pee. But for our men, they have flatulence in the bottom of the squat, they have hemorrhoids, or they have hernias. And that's a sign of them bracing in a way that isn't as advantageous for their body.
Awesome. So lots of important points raised. Would you have any advice on how to fix it?
Yeah, absolutely. So the first thing we want to be aware of is, are you bearing down when you brace, right? And so the way that I cue a brace, so say you are trying to learn this for the first time, I will tell you, if you are trying to lift the heaviest weight you can, I want you to inhale nice and big and then contract your belly as if someone was going to punch you in the gut. Because the first thing, I have little kids. If you have little kids at home, I'll say to my moms or my dads, like, brace your belly as if your toddler was about to jump on you, right? Like that, like knees in, they're like about to jump on you. The first thing you do is you bring your rib cage over your pelvis and you tighten up in that brace, right? And the same thing if you're going to get punched. And so what that does is it puts you in a rib cage over pelvis position, which is the strongest kind of length tension relationship. But then it also tries to distribute that force all the way around versus down into your perineum or the tissue in the bottom of your pelvic floor where people can experience some of these sensations. So that would be how I would cue a brace. Now, how I would figure out if you are bracing the right way or not would be how I am looking at your bracing and coaching, and then how I would evaluate you as a pelvic floor physical therapist. So if you were coming to see me for issues with pelvic floor dysfunction and you were a lifter, the first thing that I'm going to ask you to do is tell me when you leak, like what threshold, like is it as soon as you start squatting, or is it as soon as you get to like 85% of your 1 rep max? And wherever that threshold is, I'm going to ask you for a video because I want to see what you do when you start to leak. Like, is it something that's going on with how you're moving? Are you starting to compensate? Like for a deadlift, are you starting to tuck your pelvis and your back is getting a bit slinky, which is not putting your pelvic floor in a good position? And then what is your belly doing when you are trying to brace? I want to see that inhale, and then there should be a slight coming in together when you create that bracing tightness. I shouldn't see this big inhale and you almost like pushing out your belly to try and take up as much space, because that is going to put pressure down on your pelvic floor. The next thing I'm going to do is I'm going to for a video with you with a weightlifting belt, because that's a whole other variable, because where people can pee is that they inhale nice and big and then they get told to push out against their weightlifting belt. And that's like somebody squeezing in the middle of a balloon. That space needs to go somewhere, and it's not going to go to the top because that's where your rib cage is. It's going to come down and it's going to put more pressure on your pelvic floor. So your bracing sequence shouldn't change when you have a weightlifting belt. And if you're pushing out against the weightlifting belt, then that's going to potentially make you more vulnerable to having pelvic floor issues. From the pelvic floor rehab side, I'm going to get you to do a brace while I am doing a pelvic floor exam. So if anyone is not unfamiliar with pelvic floor physical therapy, we can do an internal vaginal exam for women and internal rectal exam for men, where we are able to see how your muscles are working. Your pelvic floor is just like your bicep. It contracts and relaxes when it needs to contract or relax. And we can see if you are bracing, if I ask you to brace like you had a heavy barbell on your back and I feel downward movement, that is my sign that you may be doing a bear down. And I'll do that on your back, kind of like a standard OB-GYN type of appointment, but I can also do it in standing. And I do a lot with my weightlifters, and I get them wearing their weightlifting belt to see, what do you do in real time if you were thinking about lifting something heavy?
Awesome. That's awesome. Do you want to add anything to the how Valsalva maneuver influences pelvic floor?
Yeah. Well, when we think about bracing and we think about the Valsalva maneuver, ideally our pelvic floor is contracting. So a lot of people think that they need to do Kegels or they need to do a Kegel while they're lifting, especially if they've had issues with pelvic floor dysfunction before. But that's not necessarily true because our pelvic floor is an anticipatory system. So what it means is when our body is sensing that we're going to have an increase in pressure, like we're getting ready to brace or we're getting ready to cough or sneeze, or there are other situations where pressure goes up in our belly, it's going to contract before that pressure comes on because it wants our hole to be closed, like our urethra to be closed, so that when that pressure comes on, we don't pee. So sometimes when we do a Kegel, it doesn't necessarily help as much as we think. And right now, our research is showing that, those who have incontinence with lifting tend to actually have stronger pelvic floors than those who don't. And so that means, it's all about having the right amount of pressure and it going in the right direction and you doing it with the right sequence rather than blaming yourself for being weak in one area, because it's just a little bit more complicated than that. We need to coordinate the pelvic floor with all of our other kind of muscles in our core canister in order to be as strong as possible. And so with the Valsalva maneuver, one of the things that has been a really big passion project for me and why I'm super excited to be on this podcast is that I want to try and get in front of the coaches. I want to get in front of the athletes too, but if I can get in front of the coaches and get them teaching the brace in a way that is going to support the pelvis, then I can have, women who are lifting through pregnancy, that are lifting postpartum, that are lifting through menopause, that are able to lift heavy without having or feeling those sensations of peeing. If I can tell you just like a really quick story about the Valsalva and how this can work, I think it kind of brings the picture home. So I treat a lot of athletes in the clinic, and I had a 57-year-old master's athlete. She was a power lifter. And anytime she was pulling over 275 off the ground, she was incredible. She is incredibly strong, is. She would pee everywhere. And she would go to powerlifting meets and everybody would talk about being on the platform and they would just wear pads and sometimes leak through their pads. And it was just like accepted. Started following me online. She's like, okay, I am not going to accept that this is okay anymore. And so we started doing some sequencing. So now she is not weak by any stretch of the imagination. Her pelvic floor isn't weak. Her back isn't weak. Her body isn't weak. She has a 285 squat or 300 pound squat at 57. She has a 300 plus pound deadlift. She is a tank. And amazing. But what she was doing was exactly that. She was bearing down as she was lifting and she was transitioning through menopause. So estrogen was lower. And so she was feeling like her peeing episodes were getting worse. And so we did some assessments in standing where we checked out her brace. Then I did the same thing with a weightlifting belt and we made sure that she wasn't bearing down. We didn't put any weight on her and we just fixed her bracing sequence. And then when she caught that, she's like, okay, this is how I brace. This is how I figure it out. Then we moved that into the gym and we got her deadlifting, focusing on all of those cues that we did in the treatment room there. And she stopped peeing. I didn't do 6 or 8 weeks of Kegel training. It wasn't that. And for some people, they will need that, especially, postpartum, or if they're have experienced an injury or something like that, we may need some recoordination. But for her, it was just figuring out how to brace with the proper movement mechanic, right? It's pretty complicated. It takes a lot of time to learn. And we were able to clear her stuff up in 3 or 4 sessions. And so just incredible things that we can do when we clean up some of our bracing sequences. It can make a huge difference in how strong and how supported you feel in your lifting.
Okay, so you mentioned with this athlete, but in general, how pelvic floor dysfunction is treated?
Yeah. So when we are thinking about, I prescribe to a very fitness forward mindset when it comes to pelvic PT. So I will do an internal exam where I'm seeing, is your muscle contracting or relaxing at the right time? Is it coordinated? And then we try and figure out, when is your threshold for symptoms? So that's kind of our first day one. Is like, is your pelvic floor working at the right time? Is it contracting when it needs to? Is it relaxing when it needs to? That's kind of the foundations of rehab. But then we're trying to figure out, when are you starting to feel symptoms? Is it when you run? Is it when you've had a cold? When you're vomiting? When you haven't eaten well enough and you're feeling constipated? Like, are you having pain with sexual activities? Like, whatever it may be, anything pain, dysfunction, leaking around the pelvis. We're trying to figure out what are those situations and circumstances that you're starting to feel those symptoms. I treat a lot of people who are experiencing those symptoms with exercise or with activity. And then from there, we try and build up your volume until we meet your threshold where you're starting to pee. And then we try and increase that threshold with strength training or other types of endurance. So that's kind of like the basis of rehab. So in a lot of ways, the way that I treat the pelvic floor is no different than if you came to see me with shoulder pain, right? We would try and make sure that the shoulder was moving in the right directions, that we had the right coordination of all of the muscles, and then we would gradually start loading up the muscles that need it in order for you to build as much capacity as you need in overhead movements until your pain hopefully goes away. And so it is, a lot of people think that it's a very different type of rehab, but it is very much the same compared to, a lot of things that we do if you went for any other injury. It's just a little bit more vulnerable part of the body.
For sure. Okay, so from the topics I prepared, we covered everything apart from pregnancy.
Yeah, let's dive right into pregnancy. Okay, let's do it. Okay, so with pregnancy, we have for so long tried to protect the pregnant person by putting them in bubble wrap. Okay, we have people get recommendations to not lift more than 20 pounds, that they shouldn't be lifting their other kiddos when they're pregnant because of stress and strain on the body. With the idea being that your body is already under so much strain, we don't want to add to it. I honestly think that is the most BS theoretical framework I've ever heard. Because on what circumstance would we say, okay, you are demanding a lot of your body, let's decondition you and make you weaker, and that is going to make it way more likely that you are able to tolerate this challenge. You want to run a marathon? Let's put you on the couch for a week. That's going to make it feel way easier to go and do this physical feat that you are asking of your body, right? But pregnancy is such a protected time. So if we don't know, the answer is no. Insert the last 10 to 15 years with the rise of powerlifting and CrossFit and weightlifting and all these incredible things that have taught women that we can be freaking strong and that we like it. We like feeling strong. And that means that if we are doing resistance training regularly and we decide that we want to have a kiddo, there's so many times that we want to continue what we were doing in exercise, right? And so 5 years ago, when I got pregnant with my daughter, I guess almost 6 years ago now, we had all the things, right? Like, your baby's going to die, like your organs are going to fall out of your body, all of this negative fear-focused messaging. And the reason why it was there is because we just didn't know. We just didn't know. And so it is such an exciting time to be a woman who lifts weights, or a person with a uterus that lifts weights, because we are starting to get more data. And so this started, for me, my journey in this research area, it started with a cross-sectional survey that was published last year. There was just under 700 people. We've talked about this study where we talked about the Valsalva maneuver. So what we saw was that those who continued to Valsalva or breath hold during their pregnancy did not have an increased risk in pelvic floor dysfunction postpartum than those who did. And those who developed incontinence during their pregnancy were weaker than those that didn't, right? Good news so far from a safety perspective. We also didn't see any increased risk of preeclampsia, gestational hypertension, all those things kind of centered around Valsalva, all these things that were fears, right? Because the idea was your blood pressure could go up and that could harm baby. We don't have any evidence to support that. It's going to put strain on your pelvic floor. Your pelvic floor is already under strain during pregnancy. It's going to make you have pelvic floor dysfunction postpartum. We don't have evidence for that anymore. We now also have 2 hemodynamic studies that have looked at the blood flow to mom and blood flow to baby with the Valsalva maneuver one with an incline bench press and one with a leg press. And both have not shown any adverse effects to mom or baby when breath hold bracing during pregnancy. So all this is great news because it gets rid of some of this idea that there has to be an upward cap on the body, especially if you've been strength training going into pregnancy, that you can continue. What we don't really know now is what's like the best protocol. Like, do we need these recommendations to change? Like, can you just do whatever you were, like literally whatever you were doing before pregnancy? We have some athletes who are coming back to heavy weightlifting 5 days postpartum, which is wild. Like, we are seeing the complete opposite side of the spectrum. And the answer is we truly just don't know like what is bad or what is good. And now, because there's this growing, beautiful group of people who are continuing to lift heavy, I can do more research in this area. And so now what we're trying to do is we're trying to get exercise logs from pregnant people who either were just newly postpartum and strength trained during their pregnancy. And we have a study where we're following women who were strength training during their pregnancy or are currently strength training during their pregnancy to see like what comes up. Pain comes up a lot in pregnancy. Like, can we mitigate it with strength training? What are some of the complications that come up? Like, what are things that maybe we need to be mindful of when we're thinking about loading? Like, what is the idea? Like, should we think that we can get to 60 or 65% of our 1 rep max, like right before delivery, pending that you're feeling okay? Like, what are some of those buoys? And can we heavy lift during pregnancy and use the Valsalva maneuver? And so Christina of 2020 would have said, don't Valsalva during pregnancy, right? It's too much. Like, just exhale as you are in the hardest part of your movement. That's not what Christina of 2024 says, like with the new research coming out. I give like options. Here's ways that you can breathe and brace during strength training when you're pregnant. And you can pick what works for you. Like, you can pick what works for your body. None of these are bad. All of these can be helpful. And we've just seen this such a big shift away, at least in my spaces, around the fear, breath hold bracing during pregnancy. And what we have seen is the other side where women are staying stronger during their pregnancy. And then they're like, oh my gosh, I feel so much better postpartum. I do not feel as vulnerable or as weak. Yes, my perineum is swollen if I had a vaginal delivery. Yes, I'm recovering from having a baby, but I feel stronger. Rehab still has to happen and you're not going to feel exactly yourself, obviously, right after having a baby. But I always say that motherhood is hard. Motherhood deconditioned is harder. And so can we make it just a little bit less hard? And honestly, I'm an athlete myself. Like, I have been barbell training for 10 years. I have done strength training, pregnant, postpartum, or both. In weightlifting, I've competed in powerlifting, I've competed in CrossFit, and I love it. It would legitimately depress me if you told me that for 9 months, I couldn't lift more than 20 pounds when literally barbells are my love language. And so like my mission has been to make sure that no one gets that advice ever again, unless it's truly necessary. Like we have something like, a complication in pregnancy that would make it warranted, but your OB would tell you that, you're on pelvic rest or something like that when you're in more of those complicated conditions, and you would deal with it, if that was to happen. But
the good thing is the studies are starting to coming up. You are responsible for some of them, so bright future ahead of us. We will know more. If there are some things we should be aware, we will hopefully soon know. But in general, you think that Valsalva is safe also during pregnancy, and there are other things at play we now considering and checking, so we should know more soon. That's exciting. Okay, 2 quick questions to finish. First one is, what is your favorite lift?
So I would have to say the snatch, because it is beautiful. Like when it hits and the timing and the sequencing and it just like gets overhead and it locks out and it feels so light, it just magic happens. It's just so beautiful. And I've done tens of thousands of snatches and I still love them. They're my favorite.
Okay, where people can find you if they want to get in touch or follow your work, where should they go online?
Yeah, so you can probably follow me on Instagram. So I'm at Dr.Christina_Prevett. I teach courses in lifting and pelvic floor dysfunction through the Institute of Clinical Excellence. So if you're a clinician or an exercise professional who's looking to really deep dive into some of these concepts or want to learn a little bit more about the pelvic floor, we teach 2 online courses, level 1, level 2, and a live 2-day course on this material where where in our live course, we go through bracing and we talk about the sequencing and we try different breast strategies so that we can give you frameworks to help individuals who are leaking with lifting get back to being as strong as they can be or being as strong as they want to be. So you can also find me at Ice Physio. That's our online.
Awesome. Thank you so much, Christina. It was a pleasure.
You're so welcome. Thank you so much.